My name is Mathabo Makuta, the National Director for Habitat for Humanity Zambia. Today I'll be presenting for Housing Forum on the topic on Build Back Better, the housing sector delivery systems in the Global South post-COVID-19 pandemic. Today's presentation will be focusing more on the impact of COVID-19 in the Global South. And COVID-19 brings to reality existing vulnerabilities that require different sets of national policies and resilient approaches in the housing sector to address the challenges of access to decent shelter. In the Global South, I will be focusing more on African countries, where large numbers of COVID-19 are concentrating in greater numbers in cities and peri-urban areas. And majority of our people are living in these informal settlements and slum areas, including the refugee camps, and are mostly vulnerable. Mostly affected are women, elderly, people living with disabilities, including migrant workers. The COVID-19 pandemic in Africa was confirmed to have spread to Africa on the 14th February 2020. The first case was recorded in Egypt. As of 23 September 2020, the recorded confirmed COVID-19 cases in Africa stood at 1,149,940. Even before COVID-19, the housing situation in Africa was a big challenge. Now we know that housing is the first line of defense against COVID-19 transmission. We have observed key challenges at 3 levels: at household level, at settlement level, as well as at city level. At household level, the biggest problem is overcrowding and poor housing quality. Lack of access to basic services, and here I must mention lack of access to adequate water, which we all know that it is key in the prevention of COVID-19, as people have to wash regularly. And lack of access to health care when people are affected. People are now or have been requested to stay at home and keep safe. And majority of them were unable to store food for long periods because of loss of jobs, as most of them work in the informal sector. Loss of livelihood as a result, and insecure tenure, as most people are renting, and it has been difficult to maintain the tenantship. We have seen increase in domestic violence due to lockdowns, and this has been a very big problem. Some people have died out of domestic violence rather than being killed by COVID-19. At the settlement level, Majority of our informal settlements are at the peri-urban and are highly densely populated, and this poses a challenge for social distancing. We have shared communal facilities, and overcrowding at these communal facilities like communal water pipes, standpipes, has been a big problem, including lack of adequate sanitation facilities. We have also seen limitation in terms of access to social services, as many of people living in informal settlements are challenged by overcrowdedness when others needed to be isolated. We have seen challenges with provision of isolated facilities. At the city level, mostly in our African cities, there is high numbers of homelessness. Majority of those that are homeless are mostly kids and young generations that are sleeping in the streets. During this time, there was a need for them to be taken care of in order to curb the spread of COVID-19. But the challenge with the limitation of the shelters where to accommodate the homelessness. We have seen the challenge in the health sector, where a majority of the health workers could no longer be able to get back to their families in order to protect them or at least be exposed to the COVID-19. Then it shows that there to be temporary housing for essential workers, and this was a challenge. Majority of our people, like I have mentioned, are living in peri-urban, informal settlements, and are renters. They do not have their own homes, and they needed to be protected as they lose their livelihood in terms of making money to pay rentals. These were some of the challenges that came to the fore. The public transport is also a risk, as many people use public transport to get to their work and back, and it is difficult, if not impossible, to keep social distancing within public transport. And we have now realized the importance of green spaces that would allow people to get out and breathe oxygen that is needed mostly at this time. The main focus now of this presentation is now how can we build back better the housing sector delivery system from the present to the future. We need to look at the contextual conditions of our settlements. For us to do that, we need to understand the community needs and priorities. The most important aspect is to ensure that there is access to basic services. COVID-19 has brought this to our attention, and we need to act and act fast. The existing housing conditions are at the point where they needed to be assessed. As we do that, we also have to have in mind the affordability levels as well as inclusion of community actors in all the planning processes. up to the implementation level. The housing market conditions for people to be able to access decent shelter, they need to have access to finance. Our financial institutions are ready to respond to the recovery phase. We need to do the housing market assessments, as well as making sure that there is access to materials and construction skills. And here, it should not be business as usual. We should be mindful of the resilient component of our construction materials, be innovative and creative in terms of the construction skills that could be used for resilient in future. We have seen that we had to respond in order to sustain livelihoods of many vulnerable communities through cash grants program. We need to carefully look at the current policies and see where there has been some limitations. Most importantly, how we can make policies that are more pro-poor, as well as we implement the management systems, land administration systems that are fit for purpose. And we would also need government interventions with relevant and targeted interventions that have targeted subsidies to those that may need. Here, the big challenge that we have realized that needed to be addressed going forward as we do build back better is the institutional arrangement and institutional capacities to be able to change the landscape and how we have been doing business in the housing sector to be able to respond adequately in future. The last piece, but very important and critical, is the recovery and resilient phase. We need now to build resilient households and communities. And this we could do by making sure that they stay connected, participate, and are engaged in all the programs that are intended to change their lives. We need to provide them with healthy and knowledge that empowers them to be able to make better decisions as to how to be able to be resilient to further shocks. We need to have access to safe and resilient shelters, and this is where the focus of our attention for this forum should be, as we have seen that housing is the first line of defense during this COVID pandemic, and not during this COVID pandemic only, but also as a dignity for the families and safety as they have to have their own secured places. We need to also think through of the essential services and infrastructures that are holistic in terms of addressing the needs in terms of pandemics or disasters. At this point, I must mention that Habitat for Humanity Zambia has also taken and also made an effort to contribute in the fight against COVID-19 in Zambia. And I would like to take a moment to share with you what Zambia did during this COVID-19.
Hi, my name is Mathabo Makuta, National Director for Habitat for Humanity Zambia. Indeed, COVID-19 has affected each and every one of us. As an organization, we have prioritized the provision of clean, safe water under our WASH program in unplanned settlements that are densely populated with inadequate access to basic facilities to maximize good hygiene as a first line of defense. We have been providing water by installation of boreholes, open and closed kiosks, and 59 water points have been set in the peri-urban of Lusaka, Kabwe, and Ndola.
Kafika kuseni nifunika kupyanga. Nikapyanga nisegula mazi wantu wambota pamazi. Wantu wakafika pano kubankalo pasana ma distance. Ma 1 meter na ma mask. Then na kusamba kumanja. Ndiye mwamnisebenzela wantu pano.
We are also sensitizing communities on hand washing, staying home, social distancing, and wearing of masks when out of their homes to collect water.
I thank you very much for your attention.